Good morning, and thank you so much for joining us for this edition of SBB University. Very excited today to bring on a talk about Parkinson's disease. Joining us from Lee Health, we have Nathalie Grondin. How are you this morning, Nathalie?
Nathalie Grondin is doing great.
Thank you for joining us today. All right.
Thank you.
And we have Mary Schoeffel, who is with us from the Parkinsons Association of Southwest Florida. How are you this morning, Mary?
Doing well. Thank you for the invitation.
Absolutely. Mr. John Botsko joining us from BrightStar Care. How are you this morning?
Hey, Amanda. Good morning, everyone. Great to be here.
Thank you. And Michelle Martin with Hope Parkinson's Program. How are you?
Great. Thank you very much for inviting me.
Absolutely. Now, I want to do a couple minutes of introductions. Tell me a little bit about yourself and the organization that you're here representing. And also, I love to hear, this is probably my favorite part of doing these. Tell me your why, what brought you into the industry, and your why for being here. So we'll start with Nathalie.
Thank you, Amanda. I am a physical therapist. I've been with Lee Health for 20 years, and I'm also the leader coordinator of the Parkinson's rehab team within Lee Health. And the why is I'm a firm believer that therapists in general are keepers of hope. And we, good for Hope Parkinson Program,
Yeah,
right? That's why we collaborate with them a lot too. But through therapy, people can find like a new lease on life, if you will, and find out that there's a lot that they can do to help their quality of life and also to help the care partners. That's very important, especially with Parkinson's.
Yes, absolutely. All right, Miss Mary, you're up. Tell us a little bit about yourself. I know you're new to the Parkinson's Association of Southwest Florida. What brought you over to this beautiful industry and to the company?
Well, I thank you very much, Amanda, for this opportunity to talk about what we do here at Parkinson's Association of Southwest Florida. I have been in the health and wellness arena for, I won't mention how many years, but it's been for a while. And I've come at it from the actual medical side as well as the environmental side and what affects people. And this is a blending of the two. The great thing about this particular group of wonderful people is that we're all about improving the quality of life, and anything we can do, just to echo what Nathalie said, anything we can do to improve, to educate, to enrich, and to empower people to take care of themselves and to help mitigate some of the symptoms of Parkinson's so that they have a fuller life. That's why I'm here, to help with that.
Wonderful. And I know you have very similar missions, so I'll follow suit with Michelle. Tell me a little bit about yourself, your background, and your why.
I'm Michelle Martin with the Hope Parkinson Program, and we've been serving the local Lee County Parkinson's community for over 10 years. I've been with the program around 8 or 9 years. I have a passion for Parkinson's disease, both professionally and personally. A close family member was diagnosed with Parkinson's and lived with Parkinson's for probably more than 30 years. So it was a long journey. Parkinson's many times can be a very long, and we try to focus on quality of life as well. So letting people know that this is not something that's, very quick and fast death sentence. Like some people get that feeling when they're diagnosed with something new that they don't know about. I've had a lot of people tell me like, how long do I have, Michelle? And I'm like, you got decades, 10, 20, 30, 40 years. So the hope does fit with our program too. And what I'm so lucky to be able to get to do and give people who are like just really new to the diagnosis some hope that there are lots and lots of things that people can do to live a long, happy, good quality of life with Parkinson's disease. So we focus a lot on education, support groups, really connections, building connections, friends, connecting people with Nathalie that for physical therapy, Parkinson's specific physical therapists, with exercise and movement programming, exercise classes, social activities to be able to interact and meet new friends. And those are, in the last year with COVID, those are all things that we found out kind of the hard way, how super important they are, because so many people and members with Parkinson's have really had a tough time this last year and a half.
Absolutely, they sure have. All right, John, welcome aboard. How are you this morning?
Very good. Thank you, Amanda.
Tell me a little bit about yourself, your background, and what led you into home care.
Well, I started BrightStar 15 years ago. We provide private duty home care as well as skilled care in addition to personal care. But after several years in the hospital administration industry, I found that God was calling me to serve the elderly. So I was fortunate enough to come across BrightStar, which was new at the time, and began serving the people in Southwest Florida who might need home care. And I think that's really our why. So our why is to improve the lives of the people in Southwest Florida who choose to stay at home, and we can improve their lives at home and make it a better transition instead of going into a facility if they choose not to go into a facility. So that's our why.
Yes, wonderful. And you have a definite soft spot, I will say, for the Parkinson's community. I know that you're very philanthropic, sit on multiple boards, and also Struthers certified. Is that right?
Yes, we are Struthers certified. BrightStar is one of the Struthers certified organizations that adheres to specific provisions and policies relative to treating Parkinson's patients.
Absolutely. Perfect. Well, let's get started with a couple rounds of questions. I think it's appropriate that we start with you, Mary. Talk to me a little bit about what Parkinson's disease is and more of the history and demographics that's around it.
I can do history and then I'll let Michelle jump in. Parkinson's has been identified and talked about for millennia. I mean, it's written about in Sanskrit of all things, but it took Dr. James Parkinson in London in the 1800s to actually study and come to some conclusions. But we've learned so much since then. And first and foremost, not all Parkinsons have shakes or palsy, and not all people who have tremors are Parkinsonians. And of course, that's what everybody else has focused on. The original Sanskrit word had to do with palsy. And then, of course, what we all know is that Parkinson's is a late diagnosis. It takes a while and several misdiagnoses. At least that's what I'm learning in my short 6 months, is that coming to that conclusion, again, some people, even neurologists, are not that well schooled. And so it takes several groups of sessions and different teams of medical professionals to come with it, because when you look at some of the symptoms, I mean, when you think about just muscle and movement and mood, and you put all of those together, they don't always look exactly the same. And that also impacts then how people in the community react. And so that's part of what we do, is we're making sure we educate not only the Parkinsonians and the care partners about what to do at what stage, but also about the community, so that if they happen to have an encounter with someone who has a rigid mask of a face, that they're not mad, they're not irate. And oh my gosh, the mental processes going on behind everything are fantastic. We just have to give people time to express themselves and to do what they need to do. And again, it's all tied to movement and mental, and that's not getting into the dopamine and every other aspect of it. But I hope that covers that aspect of it. The fact that it affects men more than women by at least 2 times. And generally the diagnosis is between the ages of 60 and 65. So it is one of the fastest rising diagnoses in the world. I mean, every 9 minutes, somebody's diagnosed with Parkinson's disease.
Yeah, and I know Michelle has said this before, people think it's like a death sentence. Michelle, talk to me about the process with Parkinson's. I know everyone has a different journey, but what can you expect when you're diagnosed?
I agree with Mary, what she said. Sometimes for some people, it's a little trickier to get that diagnosis right away. And then you throw in this whole other pile of the atypical Parkinsonisms, which is like the new word on the street is Parkinsonism, which is kind of a big, broad umbrella term for any symptoms looking like it may be Parkinson's disease. So that gets even the experts kind of using words in ways that are contradictory with each other even. So yeah, it can be very challenging to get a proper diagnosis. It's funny that for a lot of even experts on Parkinson's disease, once they put them on the medication, put somebody on the medication, carbidopa, levodopa, and they improve, they show improvement of symptoms. That's kind of their like, yeah, we got it right kind of thing, which seems crazy. I know they're still looking for better diagnostic tools than that, but that's still kind of where we are in the 200 plus years since Dr. Parkinson's described it. One of the things that's still really greatly needed is that diagnostic tool, or that diagnosis being a little more standardized.
Yeah, and you mentioned medications, and I know it's so imperative that Parkinsonians get their medication on time. Talk to me about why that is versus another chronological disease. Why is their diagnosis so important that they get?
Is that for me?
Go for it, Michelle.
Oh, I can't tell you exactly why. All I know is Parkinson's disease is very unique from other diseases in that timing is everything with medications. It's not an as needed kind of thing. It's a on time and every time to get that chemistry and that dopamine to be like a nice even flow and not be going up and down and up and down and on and off and on and off. That is the most common challenges that some people with Parkinson's do have after being on carbidopa, levodopa for many, many years. They have these wearing off periods where the medicine used to work, perfectly fine 3 times a day, but then they start seeing these dips in the effectiveness of the medication and symptoms kind of coming back in these, what they call wearing off periods or on and off periods. So sometimes it's different from person to person. It is kind of they call it a snowflake disease because everybody's so different. Yeah. But sometimes for some people, moving the doses closer together and adding doses, or sometimes increasing the amount of the medication. So, and there's when I first started, the National Parkinson's Foundation had a book, and it was about 20 pages long on medications for Parkinson's, and now it's like 80 pages long. So there are more and more and more medications that are used for different specific symptoms of Parkinson's disease as they learn more and more about a lot of these, what they call non-motor, or the Parkinson's you don't see, those symptoms.
Perfect. All right, John, we'll move over to you. Talk to me about your connection with Parkinson's disease.
Well, about 10 years ago, Gail Schultz, a local person who has worked in the healthcare field here in Naples, invited me to attend an education committee meeting at Parkinson's Association. And I joined the committee immediately and was involved, and ultimately then became the chairperson of that committee. And then later on, about 5 years ago, I was given the honor of joining the board, and subsequently to that served as the board chairperson, and am still serving on the board. So that's been my journey with Parkinson's.
Perfect. And also your organization, BrightStar Care, works specifically with this disease process in a unique way. Tell me a little bit about your connection with caring specifically for Parkinson's patients through BrightStar Care.
Yeah, we belong to the group of a few agencies, both home care, assisted living, and some other retirement communities who have become Struthers certified. So I think about 4 years ago, the Parkinson's Association decided that in order to help us improve the lives of those who we are treating with Parkinson's, we should have some structured ways of assisting them. And we were educated through the Struthers process and Struthers organization. So that has helped each of our caregivers who assist Parkinsonians and our director of nurses to oversee care in a much higher level of standard of care.
Wonderful. All right, Nathalie, we're going to bounce up to you. Talk to me about the role that a physical therapist plays when working with Parkinson's patients.
Right. Well, in general, I would say that the aspect that we're most interested in is the mobility, the movements, and what we call the functional independence. Is a person able to move about live life safely, as independently as possible. And we know that Parkinson's is a neurological progressive disorder. And so generally when somebody starts with therapy, we tell them, well, I guess, we might be friends for life because they're going to be not participating in therapy their whole life, but they will have what we call episodes of care so that we can reevaluate as the disease progresses and there's changes that occur. And we also are very interested, as Michelle mentioned about the medication, is we try to get a feel for how people are handling their medication and when they're better physically. And then we share that information with the doctor, because unlike a lot of other professionals, including the physicians, therapists have the luxury of time. We spend more time with patients, we see them more often for longer periods of time. Therefore, we have a better snapshot of what's happening. And a lot of times, given a little extra time, the patients might open up and the care partners might open up a little bit, tell us what's going on. And then we can really target our interventions for that. And if we find out something that we may not necessarily be able to help in therapy, but we can point it out and encourage them to talk to their other healthcare professionals.
Yeah, and I know you mentioned episodes. Tell me, what are some of the, when should someone start looking into physical therapy if they've been given that diagnosis, and what would you classify some episodes as?
So in a perfect world, the day that they receive the diagnosis would automatically receive a referral for therapy. The sooner that we can evaluate, the better. We know that it takes up to 80% loss of dopamine cells to actually, for the disease to manifest itself. So many times the disease has been progressing for years until a person gets the diagnosis. That means many, many things have been changing in their body, their mind, the way their brain works. And so as early as we can evaluate every part of their body that participates in them, their posture and how they move and their balance, and also for fall prevention, then the more we can have an impact, a positive impact. It's always better to prevent or anticipate, and we can tell because most people with Parkinson's will experience a certain set of problems. Not exactly the same, but for example, we know that people with Parkinson's will have difficulty with posture. They will have difficulty with rigidity and stiffness, which can lead to a lot of pain syndromes. And some may experience walking instability, just instability, fear of falling. That's for some later on in the disease process. Some may experience what we call freezing. And it's not that they're cold. Freezing is related to the fact that when a person attempts to move, they can't. They feel like their feet are in cement, and they do little steps that are not very effective. So it's difficult for them to either start walking, stop walking, or change direction.
Yes.
And so we look at that as well and see how that can contribute to increasing their risk of falls and how to manage it so that they don't experience that. So it's all dependent on the referral sources. It's all dependent on the neurologist, the movement disorders specialist. If the patient decides that their primary care physician is the one handling their Parkinson's, then it's dependent on whether or not that primary care physician is aware of the benefits of therapy and the fact that they probably should be referred earlier than later.
Yeah.
So I don't want to take up all this time, but I hope I made my point. The earlier, the better.
Yes, you did. Absolutely. And that's what these educational panels are all about. So we're going to bounce back over to Mary. Now we're talking about signs and symptoms. And I know it's incredibly difficult to diagnose, but what would you say are some signs and symptoms that would lead you to go to your doctor and ask specifically about Parkinson's disease? What would you say are some warning signs?
Well, there are some that I'm going to talk about that are not the more common type. Reduced handwriting. The handwriting gets smaller and more cramped. Changes in voice and vocalizations. So again, this is related to muscle, it's related to movement. This is related to muscle, this is related to movement. Constant constipation. It's not something people like to talk about, but again, it's related to everything in your gut is changing, and then the muscle as well as that. You can also have trouble sleeping, and your heart is a major muscle that needs to be working properly, and this also impacts that. So there can be dizziness and fainting and high fluctuations in blood pressure. But you know, as both Michelle and Nathalie have said, changes in balance and posture and the stiffness. And we have one member who absolutely railed at her husband's ophthalmologist. She announced, oh, by the way, he has now received the diagnosis of Parkinson's. He goes, well, I wondered about that because he doesn't blink. And you think about all the different eye tests you have, and most of us are blinking in anticipation. He hasn't blinked. Helped if you had shared that. So again, talk about that empowerment aspect, is having these conversations with your care providers, whether it's your ophthalmologist, it's someone dealing with your fingers and toes, it doesn't make any difference. Your audiologist, all of that. And then that gets into, some of those get into, again, people perceive you totally different when you have those symptoms. So I hear from members that among the greatest difficulties they face are dealing with other people's assumptions, that because they have difficulty speaking, it equals an impaired brain, or because they have the shuffling, stifled gait, that they've had a stroke and there is something wrong with their brain, but there isn't. And that's part of the awareness campaign that we like to bring to the community, as well as getting the members that we have doing all of their various levels of exercises and their speech therapy, and engaging with folks, as Michelle said, in social circles, so that you're around. And of course, that's been difficult. We've only recently started doing that again.
Definitely. Speaking of those services, talk to me about some of the programs that you have to offer there at the Parkinson's Association of Southwest Florida.
Well, we have more than 25 going on every single week. Bottom line is we're still doing Zoom. We are looking into who's going to partner with us, because we have a number of members and also our providers who have been able to do so much more via Zoom. They've been able to participate more because they don't have to build that travel time in, which is travel time consuming. It's not just the drive from point A to point B, it's getting yourself up, getting yourself ready, getting down the stairs or out into the car, and then getting from point A to point B. It's just all of the arrangements around that. So yes, we have music. We even have an improv group that is well attended. But more than anything, it's the levels of exercise. And I'm sure Nathalie's got lots of things to say about that, because as the disease progresses, there's less that you can do. But we have several seated Pilates classes that we do, and we offer virtually as well. And we actually find more people participating since then. I would say, yes, we did lose a handful of folks who were technology challenged, and we did our darndest to make sure that we could help them through, walk them through, find someone to go with them, well masked, to walk through at home. So, but we've maintained a very stable membership as a result of that. And membership is free here. I believe Michelle is the same way, but I can't, yeah. The bottom line is, it's the community that helps us provide these programs that are so essential. And can't wait to have more conversations with Michelle too about all of this.
Yes, absolutely. You guys definitely do partner together in many ways, I'm sure. So Michelle, just a couple of questions. Talk to me about the importance of exercise. And then also, just as we asked Mary, kind of go into a little description of what services that Hope has for their Parkinsonians.
Sure. Well, Hope Parkinson Program is actually part of a much larger healthcare organization. I feel very, very lucky that we really, like Nathalie said, if we're lucky, somebody will hear about or find out about our Parkinson program in the very early stages of Parkinson's disease, and we'll be there to help navigate and support them all through the early stages, mid stages. But as part of a larger organization that has served the local Lee County area for hospice care for over 40 years, and we now also have a separate palliative care program, we really do have a nice continuum of care where, as people's symptoms progress and worsen, we can kind of help transition and guide them into palliative care, and then eventually hospice care to help all the programs. The underlying thread that ties them all together is really the focus on quality of life. And I know it's very easy for me to say quality of life is more important than quantity of life. So I rather live maybe a year or two less, but have them be good years, than live to be 200 and have really terrible quality of life. So I'm very lucky that we have that whole big continuum of support for our members through all the stages of Parkinson's disease.
Yeah, and you guys offer so many different supportive services throughout all of your programs. But what are some that are specific to the Parkinson's program as far as exercise and muscle movement and things that you and Mary are kind of bouncing off of each other?
Well, there's not always a broad consensus of anything, right? Whenever you say the word all or always, you get in trouble. But with the experts, who I consider doctors who are movement disorder specialists, people like Nathalie, people who really have a lot of experience with working with people with Parkinson's for years and years, as well as a lot of the knowledge that I've gained are from actually being close and working for years with people with Parkinson's who are doing well. So I put a lot of stock into what are they doing well that is making them have such good outcomes. And the agreement across the board is exercise, exercise, exercise. So they even say for people with Parkinson's, exercise is medicine. We actually had one member one time that was diagnosed in his 30s with Parkinson's disease, and his dad was a physician, and he said, no, you don't have that. No, you don't have Parkinson's disease. And he was really an athlete. He was a fitness, professional. He was a coach for like the national soccer team in South America. He, in my opinion, he managed the Parkinson's for decades by his exercise regimen. And he wasn't on medication, but he kept his symptoms mild for such a long time, being so exercise being part of his life. And then when he was in his 50s, he finally got re-diagnosed with Parkinson's, and he really did have Parkinson's. He probably had it all that time. But I have heard and seen of so many people. We've even had people in our program who came to our program in a wheelchair and then got involved in exercise classes. And they went from a wheelchair to a walker to a cane to driving again. And it's like, woohoo! Those are the kind of things that, really, really make me passionate about what I get to do. So exercise. Just because of that, we're gonna skip John and come back to you, because I want to ask Nathalie, what are some of the best exercises that Parkinsonians should be looking to do?
So in therapy in the last few years, there has been a development of a concept of type of exercise that was best for people with Parkinson's. So one of the issues is that people with Parkinson's do not perceive the effort that they put forth towards creating and sustaining movement that is actually realistic. So that means that leads to small movements, right? So imagine like I'm doing, opening my hands, and after a while, the coordination gets to its very small movements, repetitive. And we see that when they put forth effort to get out of a chair, let's say, or anything that they do.
Sure.
And so a therapist by the name of Becky Farley discovered several years ago that an approach that the basis was to always think big movements, big volume for voice as well. And this has really directed what therapists use now as techniques to help people with Parkinson's. Now, this is in the rehab field. So some of you may have heard of Lee Silverman voice therapy, that's LSVT, and big and loud. So loud is that portion that helps with speech language pathology, the communication, the speech. And the big is the approach that's utilized towards movement, always to think big. And furthermore, Becky developed another subspecialty of that approach, if you will, called POWER. And it is PWR, stands for Parkinson's Wellness Recovery. And this is an approach that most therapists in Lee Health who work with people who have Parkinson's will utilize. And you have these flow sequences that teach big movements. And so that's been very helpful. But in general, other types of exercises, anything that will actually relate to high intensity.
Mm-hmm.
It's been proven that, again, people with Parkinson's have to push themselves more than they think. Of course, we think about safety, but this is why, excuse me, program like a Rock Steady Boxing, which Michelle has participated in the past. And Michelle's done everything, by the way. So Rock Steady Boxing has been excellent for people with Parkinson's, as well as pedaling for Parkinson's. So it's basically exercising, but with either with a partner on a bike with 2 seats, or as part of a program where they really, really pedal, not a little leisurely type of pedaling. There's adapted tango. I was certified in adapted tango, so that was dancing for Parkinson's. That was very helpful. Other programs, Tai Chi for Parkinson's. Yeah, Michelle did that too. There's another one called urban polling, which is walking poles for people with Parkinson's. Yeah, Michelle did that too. Is there anything you haven't done, Michelle? She's a specialist in everything. So what other programs might I be forgetting? I hope I'm not forgetting anything. But basically, what I want to say is, if you have Parkinson's and you're looking to work with someone in therapy, whether it's a speech language pathology, a specialist, a pathologist, an occupational therapist, or a physical therapist, don't be afraid to ask questions and ask them what their philosophy of treatment is for people with Parkinson's. If the therapist says, oh, well, you just do, 10 squats, and that, for sure that therapist is not really specialized in Parkinson's. And it's okay to shop around. It's okay to ask. You want to have the best intervention possible when you work with a therapist. So any of us on the panel, we know, what's right and what's best, because that's what we specialize in. So that's great that we get to collaborate.
It is. And it's such a pleasure to bring all of you on for that very reason. Now, John, we're going to wrap it up with you. A couple questions for you as well. There's so much going on in with, the board now. What direction is the board planning for the future? And then also talk to me as far as home care is concerned. There are caregivers that are caring for their spouses, or adult children that are caring for their parents. What about caregiver burnout, and how does that relate to Parkinson's, and what can BrightStar do to help?
So the first part of that question pertains to something that Mary Schoeffel, as well as Bill Morgan, who's the chairman of the board at Parkinson's, they're working on an affiliation with the University of Miami to bring on board, at least initially part-time, a movement disorder specialist to help in that regard. That Nathalie and Michelle and Mary were touching on all the different varieties of movement problems, issues, and disorders that Parkinsonians have. So with this affiliation with the University of Miami, we're hopeful that we will have at least a person a half a day or 1 day a week to start very soon with this affiliation. In regard to the caregiver burnout type of issue, it is very apparent. It does take its toll on a husband or a wife or another family member who might be providing assistance. And BrightStar and other agencies can provide respite for that, where we can come in and do some of that work instead of the spouse to relieve the burnout. So that is a very common thing we can help with.
Yeah, it's so important. As you guys all know, statistically, when it comes down to it, caregiver burnout can cause a caregiver to pass away before the person they're caring for. So it's always good to have a plan, not wait for a crisis before you call John to talk about services. Because if something happens to you and you're the caregiver, you end up in the hospital, you're going to need to have those services lined up. So never too early. It's definitely something that you want to plan for if you're diagnosed with something, not just Parkinson's, any disease, for sure. Now, support groups are great for the family members as well as the Parkinsonians themselves. Both Mary and Michelle's organizations do provide support groups, and Nathalie provides physical support. and John provides physical support as well. So what a dynamic group that we have on here today. It's been a pleasure getting to know all of you. If you have questions, please put them in the chat and we will get your answers to you right away. But with that, I hope that you all enjoy your